Today, I'm going to talk about entitled Laennec for non-alcoholic fatty liver disease and alcoholic liver disease. Next slide, please. Yes, this is my profile. I'm honorary director of Japan Society of Clinical Placenta Medicine and president of Japanese Association of Eastern Medicine, as well as assistant professor of Division Medical Education at Juntendo University School of Medicine. Next slide, please. And I'm also director of Kichijoji Traditional Chinese Medicine Clinic, and we provide medical care that combines the best of Western and Eastern medicine. And okay. So first of all, next slide, please. First of all, what is placenta therapy? Do you know what is a placenta therapy? I'm going to talk about the definition of placenta therapy. Placenta therapy is defined as therapy using placenta. Human placenta is used for injection, while animal placenta from pigs and horses, porcine and equine, is used for supplements and cosmetics. Next slide, please. And the word placenta comes from the Latin word for cake, being flat, slab-like, in reference to its round, flat appearance in humans. Next slide, please. And placenta is often called as the ultimate organ. Let's find out why the placenta is called as such. And these are 4 functions of the human placenta. And the placenta provides the oxygen and nutrients necessary for fetal growth as an interface between the mother and fetus, and also serves to excrete waste products. The placenta has roughly 4 functions for healthy growth of the fetus. 1, proliferation, facilitating growth from one cell, fertilized egg, to a roughly 3 kilograms baby over approximately 280 days. 2, control, to appropriately adjust the growth speed. 3, induce differentiation, to promote differentiation from a single cell, fertilized egg, to various organs such as bones and skin. And 4, substitution, to assist the function of organs. These are the functions of the human placenta. Next slide, please. I'm going to talk about the history of placenta therapy in Asia. Next slide, please. That's ancient history. Human placenta was used in past folk remedies in Asian countries. Princess Yang Huifei, who was famous for beautiful woman, lived in the 3rd century in China, was said to have used placenta to maintain her beauty. Next slide, please. Have you ever seen the placenta as natural medicine? This is a picture, and this is a maternal side of placenta as natural medicine. So we've been using this medicine for more than 1,000 years. Next slide, please. And next, modern history. Placenta implantation therapy. I'm going to talk about placenta implantation therapy. Placenta implantation was started by Dr. Filatov of Odessa Medical College in the former Soviet Union, USSR, in the 1930s. Subsequently, this therapy was found to be effective for the treatment of many diseases, and its use has evolved. Next slide, please. I'm going to talk about Dr. Filatov. Placental medication have been used in modern clinical therapy since the first quarter of the 20th century. In the 1920s, Professor V.P. Filatov, a famous Russian doctor, developed a method of placental implantation histotherapy in which healthy tissue, skin and placenta, is, after being sterilized, implanted under the skin. This is a picture of Dr. Filatov. Next slide, please. And placenta implantation therapy. I'm going to talk about placenta implantation therapy. And this is the origin of human placenta injection. The doctor in the picture is me. I administer anesthesia via the patient's upper arm or buttocks. The processed placenta is injected using this metallic device. Interestingly, patient symptoms improve gradually with absorption of the processed placenta into the body. Next slide, please. And I'm going to talk about, wait a minute. I'm going to talk about paper implantation entitled Implantation Placenta Tissue in Patients with Rheumatoid Arthritis. And from the 1950s to 1970s, this therapy was practiced in many developed countries. Let me show you this paper. And in summary, next slide, please. In summary, in a group of 35 patients with rheumatoid arthritis, there was evidence of grade 2 improvement in 16 patients following subcutaneous implantation of human placental tissue. So next slide, please. So human placenta extract injection. I'm going to talk about human placenta extract injection. In the 1950s, therapeutic components were successfully extracted from human placentas in Japan and given the commercial name Laennec. Next slide, please. And this is a picture of Laennec. Laennec is covered by public health insurance in Japan. Next slide, please. I'm going to talk about a clinical study entitled Placenta Injection was Superior to Placebo in Patients with Chronic Liver Diseases in a double-blind crossover comparative study. And in this study, 124 chronic hepatitis and liver cirrhosis patients were enrolled in the study and divided into two groups. Each group received placenta injection or placebo for the first 2 weeks. Then, those who received placenta injection in the first 2 weeks were switched to placebo treatment, and those who received placebo in the first 2 weeks were switched to placenta treatment, crossover method. The total of 4-week treatment was repeated for another 4 weeks. Next slide, please. This is the results. And liver function was significantly improved in patients treated with placenta injection as compared with those who received the placebo. In red circle is Laennec administration, and in black circle is placebo administration. Next slide, please. Then I'm going to talk about improvement of hepatic function in chronic hepatic diseases, alcoholic liver disease, non-alcoholic fatty liver disease, NAFLD, and non-alcoholic steatohepatitis. So I'm going to talk about Laennec for alcoholic liver disease, non-alcoholic fatty liver disease, NAFLD, and non-alcoholic steatohepatitis, NASH. And as you know, non-alcoholic liver disease, often referred as NAFLD, is a problem that affects people who drink little to no alcohol. In NAFLD, too much fat builds up in the liver. It is seen most often in people who are overweight or obese. Some people with NAFLD can develop non-alcoholic steatohepatitis, also termed NASH. NASH is a serious form of fatty liver disease that causes the liver to swell and become damaged due to fat deposits within it. Next slide, please. Let me show you a case of alcoholic liver disease. Case. 54-year-old male presented to the clinic with complaints of elevated liver enzymes and fatigue. At his annual checkup, he was pointed out as having elevated liver enzymes. Since that time, he had been feeling fatigue. At the first visit, his ALT and gamma GTP levels were 42 and 121, respectively. He did not have viral hepatitis. His alcohol consumption was 360 milliliters per day, and BMI was 19.5. And ultrasonography revealed that he had a fatty liver. And his alcohol consumption was high, equal 44 grams per day of alcohol. He drank Japanese sake every day. And this is a diagnosis. And although we did not perform liver biopsy, we diagnosed him with alcoholic liver disease and fatty liver. A lifestyle intervention was ineffective. Therefore, we started administering Laennec for 4 ampoules once a month at 6 months after the first visit. Next slide, please. Next slide, please. And this is the results. His ALT and gamma GTP gradually improved and normalized at 2 years after the first administration. Also, his fatigue resolved. At present, his treatment is continuing. Next slide, please. Next, let me show you another clinical trials of NAFLD and NASH. Next slide, please. And I'm going to talk about the clinical study entitled Efficacy and Safety of placenta extract for alcoholic and non-alcoholic steatohepatitis, an open-label randomized comparative study. And so this was a multi-center open-label randomized comparative non-inferiority study to evaluate the efficacy and safety of human placenta extract HPE in patients with alcoholic or non-alcoholic steatohepatitis, ASH or NASH, respectively. The eligibility criteria required the demonstration of non-viral chronic hepatitis persisting for at least 6 months and elevation baseline ALT 1.5 times the upper normal level or 60 international units per liter of at least 2 consecutive liver tests persisting for at least 6 months. 70 patients received HPE and 84 patients received a mixture of 15 microliters of mammalian liver extract and 10 milligrams of flavin adenine dinucleotide, LEFAD, with both for consecutive days, both for 5 consecutive days per week by either a subcutaneous or intramuscular route. Next slide, please. And this is the results. The rate of achieving the primary efficacy endpoint, number of patients whose ALT improved by 20% or above, was 53.7% in the HPE group and 46.4% in the LEFAD group based on ITT analysis, showing that HPE was non-inferior to LEFAD, and no serious adverse events occurred during this study. Next slide, please. Let me show you another article entitled Human Placental Extract Treatment for Non-Alcoholic Steatohepatitis, Non-Response to Lifestyle Intervention, a pilot study. 10 biopsy-proven NASH patients who did not achieve normalization of alanine aminotransferase ALT level above 30 international units per liter. 12-week lifestyle intervention received milliliters day of human placental extract by intramuscular administration twice per week. Next slide, please. And this is a result. Serum transaminase activities were significantly lower at 8 weeks compared with pre-treatment levels in 9 patients who continued treatment for 24 weeks. In 7 patients who went post-treatment biopsies, the NAFLD activity score, NAS, the unweighted sum of the scores, steatosis from 0 to 3, lobular inflammation from 0 to 3, and ballooning degeneration from 0 to 2, mildly decreased from 5.29 to 4.00 without reaching significance. A histological response was observed in all 3 obese patients and in only 1 of 4 non-obese ones. Thus, histological efficacy may be better in obese patients. Next slide, please. And I'm going to talk about possibility of anti-cancer effects. Next slide, please. Let me show you another interesting article. In this study, they demonstrated that extracts of placental lysates reduce the malignancy of variety of human tumor cell lines in a species-unrestricted manner, although the manufacturing method is different from that of Laennec. Next slide, please. And proliferation of the mild monocytic cell line in HL60, figure 1A, androgen-dependent prostate cancer cell line, LNCAP, figure 1B, and androgen-dependent prostate cancer cell line, PC3, figure 1C, and mouse Lewis lung carcinoma, LSC, figure 1D, was shown to be inhibited by placental lysate extracts. Although there is no report of HPE being ineffective against cancer, some doctors reported that HPE had improved fatigue associated with cancer. Next slide, please. I'm going to talk about clinical tips. This is the initial consensus-based treatment protocol established through the experience of many doctors who have been practicing HPE. For liver, from 2 to 4 ampules once a week, and for fatigue, from 2 to 4 ampules twice a week. Next slide, please. And this is the reported side effects. As you see, injection site pain about 2.5%, sensitivity, rash, fever, itching 0.37%, and injection site induration 0.37%, gynecomastia 0.37%. And there are no severe side effects reported in Japan for more than 50 years. So next slide, please. And I'm going to talk about contraindication. And Laennec has no contraindication except in cases of allergy to it. Next slide, please. Let me introduce you the Japan Placenta Medical Association. I'm honorary director of this association. Next slide, please. This is the summary of activities. We have members of 321, including medical doctors, 253, and dentists, 46, pharmacists, 5, veterinarians, 3, others, 16. And we hold 2 annual medical conferences, as well as acupuncture point injection seminars for medical doctors. And we have JPMA certified placenta therapy doctors. Now we have certified doctor 50s. And that's all for my presentation. Thank you for your attention.
Do you have any questions?
Do you have any
Thank
questions?
you, Dr. Nagase. Yes, we do have some questions that we're gonna
Yes.
let you know in a bit. You can read them.
Mm-hmm.
So Dr. Nicole Peña is asking, what is the ideal dose for patients with alcoholic LD and
I
DH
see.
NAFLD?
I see. Maybe 4 ampoules one time a day. 4 ampoules at each time, twice a week. Twice a week. I see. At earliest 3 months. But you should try at least 6 months for 1 year.
Can you repeat that, please?
Yeah. And at least you should administer patients LAENNEC for three months and average 6 months. And some patients, some result will get after a year. So I think you should continue administering LAENNEC treatment at least 1 year. Is it okay?
Can you get it?
Yes, I think it's understood.
Yes. How long should how long should the therapy be continued? It depends on the patients. If the liver enzyme has normalized, it's okay to stop administering LAENNEC. But if the liver enzyme will be got worse after stopping LAENNEC, then please start administering LAENNEC again. So it depends on the patients. Is it okay?
Did you get it?
Yes,
Did you
yes,
get it?
we got the information from the doctor. Thank you.
Is there any other questions? Okay, can you repeat the recommended doses for LD NAFLD? I see. Twice a week. Okay, and each time 4 milliliters of LAENNEC. This means 2 ampoules of LAENNEC. Okay, each time 2 ampoules LAENNEC for twice a week, and please continue at least 3 months or to 6 months. Did I answer you correctly?
Did you get it?
Yes,
Okay.
we got the information. Yes.
Is there any other question?
Yes, there should be some other questions. Let's wait for the doctors to formulate the question.
Yeah, I see.
Okay, no problem.
Okay, I'll read. What is the largest study done on liver patients? How many patients were enrolled? I see. And the first study I introduced to you is the largest study. Wait a moment. 124 patients were enrolled. Was the largest study done on liver patients. Maybe you feel this a little bit small size of clinical study, but this is the largest. Did you get it? Okay. Any suggestions on convincing patients to receive injection twice a week for at least 12 weeks? I see. And at least patients who were administered Laennec feel improvement of liver disease-related associated symptoms such as fatigue, and some patients feel, some patients who have allergic symptoms will feel allergic symptoms will be relieved. So these are the suggestions about on convincing patients to receive injections, and as well as you should check patient's blood sample in order to check liver enzymes. So many patients of liver enzymes improve at 6 months or 1 year. It's okay.
Did you get it?
Do you get it?
Yes. It was pretty clear your response to Dr. Peña.
Okay. On your slide for liver disease, it suggests once a week dosing, but now for treatment, you suggest twice a week. Why is the difference in the recommendation? I see. So it's better twice a week. I think. So on my slide, I show once a week, but it's better to administer patients twice a week. Okay. Did you get it?
Yes, she got the reply, but I mean, she has a doubt that why you have it in the slide and then you.
Yes, I see. I see. Yeah. But it's twice a week is better. I show that slide because some patients hard to come to clinical hospital twice a week. So at least once a week. Okay. Why is better? Because
to get the results.
why is it better? I see. Those Laennec seem to effective dose-dependent manner. Okay. The more dosage you administer, the result you get. It's okay.
That means.
So Laennec will effective dose-dependent manner. This is the answer.
Okay, let's wait a bit of moments so the doctors can formulate some other questions that I'm pretty sure they do have.
Okay, should we change those depending on weight of the patient? This is a very important question. I think so. So maybe average body weight of adults from 60 kilograms to 80 kilograms. So it's okay to administer dosage as I mentioned. But if patients have over 80 kilograms or 100 kilograms, you should administer dose more 1.5 time above much. It's okay. Okay. Is there a chart for this overweight person? No. We don't have any chart for this overweight patient because we don't have enough. We didn't have enough clinical trial about overweight patient. So I'm afraid, I'm sorry, we don't have enough. We don't have a chart for this overweight patient. Sorry. Based on, I'm talking about based on many doctors' clinical experience. Do I answer your question correctly?
So it's actually, you don't have the chart because it's required to have a significant amount of clinical trials to require to the Japanese authorities to give you the permission to have this chart?
Yes.
Okay.
Okay, then how will we know if the results aren't true? Because maybe we didn't do them correctly. I see. I see. And I'm talking about, as I said before, I'm talking about many Japanese doctors' clinical experience. So to date, I'm afraid that we don't have enough information about the dosage. But however, many doctors experience that Laennec effective as dose-dependent manner. I'm afraid that we don't have enough information. It's okay. So we have to do about clinical trials about this issue.
Let's give it some minutes for the doctors to pose some questions.
Okay.
Some, at least 2 or 3 more minutes so they can think and see if they have any other question or doubt that the Dr. Nagase can clarify. Okay, so
Mm.
the doctors have finished their questions to Dr. Nagase. Dr. Nagase, thank you so much for your time, for letting us know, sharing with us your experience with Laennec and the uses that the Dominican doctors can have for Laennec in fatty liver disease. For the patients, thank you so much for your time. It's good to point out that the Laennec has already the sanitary registration in the Dominican Republic, obtained like a month ago, give or take in time. And in the drug is available at the time for the doctors that may need it to start treating their patients. They can get it through us, through Global Skin Dominicana. And yes, we'll be in touch with the doctors so they'll get the drug on time.
I see. I'd like to thank you for attending to my presentation, and I'm glad if you will get enough information of my presentation. Thank you for everyone. Thank you everything.
Thank you, Dr. Nagase. Thank you so much, and thank you all the doctors that attended the webinar for your time. That is I know that is a bit difficult at this time at night for the doctors, especially on a Monday. Thank you so much.
Okay, if you have time to come to Japan, please please participate to our society association. Okay. Thank you so much.
Thank you. Thank you for the invitation. For sure, we'll be attending.
Yeah, please.
Thank you, Mr. Francisco.
Thank you, Mr. Francisco.
Thank you, Rajiv, and thank you, Dr. Nagase, for your time.
Okay. Thank you. Bye bye.